My name is Dr. Kurien. I specialize in family medicine and I'm with Vitruvian Health. I grew up in East Brainerd near Chattanooga. I went to UTC for college, and I always say that I am all of the UTC things. I love wearing chacos, I love hammocking, I love camping and hiking, so I kind of grew up here as a Southern girl, honestly. I have my husband, we're both raised here in Chattanooga. I have a 10-month-old, so he definitely keeps us busy on our toes. And then I have 2 large dogs who also keep us very busy on our toes. I think hiking and camping and going outdoors is a really big thing for me. So we already have our hiking backpack. We've taken our 10-month-old to like 6 national parks already. So he's been to more national parks than most of my friends. So that's been our main hobby now. We love watching him experience new things and different textures. I always knew I was really interested in math and science more than English and history and stuff like that. So I knew I wanted to go into some type of science field. I tried to keep my mind open throughout college as well. I did chemistry as my undergrad and biochem. And I knew I wanted to do a little bit more clinical type of field, working with patients and working with people. So I think that's kind of where I started veering more towards medicine. I love talking to people, along with the intense understanding of science and how everything works together. I think all of that together was how I knew I wanted to do medicine. I went to UTC in Chattanooga. I did BS in biochemistry. I did a lot of research and had some papers published. So I was very research heavy in my undergraduate. It was great. I loved all my peers and my professors. And then I did medical school at UTHSC in Memphis. I did a lot of my clinicals though back in Chattanooga in my 3rd and 4th year, so I'm used to the epidemiology in this area. I mean, UT definitely prepared me for everything because the training was very rigorous, and I think Chattanooga, the rotations here also prepared me really well. And then I moved down to Tuscaloosa for my residency at UA. We're just very comfortable with very sick patients that need very acute care, along with it's more of a rural setting. So I was my patient's psychiatrist, pediatrician, sports medicine. I was a lot of things to my patients, which I loved. I definitely think I am more of a jack of all trades more than a specialized type of person. So the idea of me understanding and remembering kind of the full scope of medicine versus kind of pigeonholing into one, that always interested me a lot. And then once I got into residency or even the interview process, I think the full scope of family medicine was the biggest thing that definitely interested me. I loved hospital medicine, I loved women's health, I loved older people, younger people, so I knew that's why I was going into it. And then once I got into residency, I think the continuity with the patients was definitely the thing that kept me in it, for sure. I think my favorite part is the continuity along with giving someone a chance, because especially with our environment now, a lot of people will shop and talk to different doctors, and a lot of times people are misunderstood at a lot of places. So my biggest thing that I've always done in residency too is when my patient's talking to me, I try to listen with an open mind and understand where the misunderstood people are coming from in a way, and try to give them a chance and then try to explain things that they might not have understood until now. I'm able to sit down and listen to my patients and have compassion and really hear them out. How are you doing? Is there something that you're worried about or something that you saw on the news that was different or confusing? And we could talk about it. I think my patients usually are able to tell how I stand and what I feel pretty quickly. Everyone should know that I have the time for them and they can talk to me about anything.